am live, reading Many Lifetimes. My last chapter four, the second reading, was interrupted because I lost the internet. So I only realized it when I could see that it wasn't connected. Let's hope this works better, and I hope my voice doesn't go wobbly as it does sometimes when I do it on my laptop. I continue chapter four. This is Denys Kelsey, husband of Joan Marshall Grant. She passed away in 1989. This is a description of a patient Dennis was treating along with Joan, um, because Joan has ascertained why he is still longing for alcohol and is an alcoholic. How can the condition be cured? In the case of the wounded man, take him back to the original situation, but be sure that he has not taken any alcohol when you do so. It is important that he does not confuse the present with the past. He will be freed only by regressing, unless somebody like me can relive it for him, and so release the trapped energy. This used to be done by priests, usually by two of them working together. This was so that the two priests could check with each other to be sure that neither had missed any factor, and also because they could share the burden of identification. It is the release of the repressed energy which causes the reaction. Either the patient feels it or it is felt by the person who is acting as a priest. Can you tell me anything about addiction to morphia? Opium I have known in many lives. It was used in very wise civilization, but it is important to give enough of it. A quarter of grain. Oh, I have read this before. In fact, it rudely interrupted um, when she was concentrating on one particular uh, patient who had consulted her after they discovered very often if you have died longing for alcohol because you need to dull pain, is what you can take with you in your later life. I only remember. Oh, yes, here it was. He is this young man. He was highly intelligent and rather cynical, and had frankly admitted that he could not accept our theories about reincarnation. I thought he would be difficult to hypnotize, but he reached a very deep level very rapidly and immediately went into a curious spasm. I called for Joan, and by the time she arrived in a couple of minutes, the spasms had returned to a violent rhythm, which affected only his head and trunk. It seemed as though he was struggling to escape from bonds which were holding his arms in a spread-eagled position. He thrust his head back until his spine arched in an extremity of effort. He was making heart-rending noises, half groan, half cry. In a barely decipherable splutter, he gasped, "They are cutting my tongue out with a shiv." John was trying to help him by sharing his experience, but could only get a sketchy outline of the background, as we were both fully occupied in keeping him from falling off the couch. The period was the Spanish Civil War, probably 1938. He had been working for some kind of resistance movement, or else was taking a message behind the enemy lines. He had been caught and was being tortured to reveal the names of people he was working with. He had been savagely beaten and kicked, which took place in a stone-built hut. The four men who were trying to extract information must have heard something which alarmed them, for they suddenly decided that they must make a fast getaway. They had already trussed his feet together, and they now tied his wrists to iron rings in opposite walls. Cutting out his tongue was an afterthought, to make sure that he would not give his secret away to them. He would not be able to tell it to anyone. He died alone, many hours later, agonized not only by pain but by thirst. The craving for water became more and more predominant. Added to his physical anguish was the fear that his friends would think he had betrayed them by slipping over the border, and would never know that he had refused to divulge their names. It was very difficult to pull him back to the present day. When I first grasped his hand, he identified me. He identified me with one of his captors and became violent. Gradually, I got him to obey such instructions as Grasp my hand, release it, grasp it again, let it go. Press your hand against the wall. Slowly he reclaimed his present identity, and recognized us and his surroundings. When I believed he was back in normal consciousness, I told him to move away from the couch to a chair. As he did so, he asked for a glass of water. I fetched him a large tumbler full, which he drained and then demanded a second and get a third. I told him he had drunk as much water as was good for him, but he shouted, "Bring me a jug." At this point, I realized that he was not completely back in the present, but still suffering from the thirst in which he had died. I told him to sit on the edge of the couch while I counted slowly from 20 down to 1, which brought him fully back into the present. He said, as though startled, "I'm no longer in the least thirsty." He then told me for the first time that for as long as he could remember, he had been subject to a compulsive thirst. Wherever he happened to be, he would be acutely anxious until he had assured himself that he would be able to get something to drink the moment he became thirsty. In a strange house or in a classroom or cinema, he was ill at ease until he had found out where he could instantly get a glass of water. When he was older and had become introduced to alcohol, this too often became the focus of his compulsive need. Immediately after this session, his compulsion disappeared, and in the years which had elapsed, he has had no desire for alcohol and has in fact been a teetotaler. His attitude to this experience is interesting. He admits wholeheartedly that his recovery was due to that one session, but he is still of the opinion that it has no bearing on the validity of reincarnation. One of the difficulties in psychiatry is that similar symptoms may have very different origin. Take, for instance, the irrational fear of feathers. As Joan had described in the case of Dr. Kerr Clarkson, this fear had its source in the death of one of his earlier personalities, which was associated with vultures. But 4 years ago, a patient of mine, a woman of 30, with an almost identical phobia, was cured of it by reliving an episode in which, at the age of 3, she had fallen down in a farmyard and been trampled on by a flock of geese. If the patient can relive the relevant episode, which has occurred in his current lifetime, he will probably be cured. But supposing neither the patient nor his relatives can remember such an episode, for the excellent reason that it never occurred, how then can one hope to explain the symptoms? Here we get into the field of psychoanalysis, and begin to think in the terms of the symbolical significance which feathers might have for this particular patient as a result of the torturous mechanisms of the unconscious. And while there is no doubt that in a certain number of cases this line of search will produce the answer, it is equally certain that in a considerable proportion of cases it will be unsuccessful. In a proportion of such failures, the cause undoubtedly lies within the patient, who, for one reason or another, is unable to bring himself to face some essential aspect of himself. But this explanation, which is exceedingly tempting to a therapist who is resolutely determined not to countenance the possibility that there may be other levels of the patient's experience in which the answer might lie, can be overdone. Only time and experience will show whether I am right, but I hope that the concept of the supraphysical body will contribute to our understanding of a variety of conditions which, in my experience, may be very difficult to relive. For instance, the pain experienced by some people which appears to be coming from a limb that has been amputated, the so-called phantom limb. I recall such a case which I encountered early in my psychiatrist career. The patient was a man of 50 with an unusually powerful physique, of which he had always been proud. But at the age of 15, an injury to a knee had become septic, necessitating eventually the loss of that leg. Ever since the amputation, he had suffered intense phantom limb pain. Two operations aimed at the freeing any nerves in the stump which might have been caught up in the scar tissue had proved totally ineffective, and 2 years before he consulted me, he had undergone an operation on his spinal cord, at which the nerve tracts carrying pain from that region were cut, but still the pain persisted. Psychologically, it was not difficult to find personality factors which might theoretically have accounted for his pain. But they were real, but they were dealt with thoroughly, and still the pain was unaffected. It seems at least possible that the original injury to his physical leg was, in this case, for some reason transmitted to his supraphysical, which refused to accept that the leg had been removed. And it is conceivable that therapy directed at healing his supraphysical might have brought relief. Related to this type of problem, possibly, are some of those cases in which, following an accident, a lack of function persists, which is in excess of what the remaining physical disability would seem to justify. Undoubtedly, some of these cases are linked to a hope of financial compensation for the accident on a scale which would be diminished by a complete recovery. But I do not think this explains all of them. It seems to me, at least, possible that sometimes it is the supraphysical which has been injured and still needs treatment. Another condition which may be difficult to relive is hypochondriitis. Hypochondriasis. The fear that one is suffering or about to suffer from some grave disease. It is characteristic of this type of anxiety that it is not relieved by the most detailed reassurance based upon the findings of searching examination and investigation. A proportion of these cases can be explained and helped along orthodox psychological lines. For instance, their fear may be the expression of unconscious feelings of guilt for which they are trying to punish themselves. But there are others in which this approach seems to be valueless. And in at least some of these, I believe that the anxiety stems from an earlier supraphysical, which died of the disease from which the patient is convinced he is still suffering. Finally, there's the rather large group of cases whose symptoms tend to be labeled hysterical. Such patients either have a physical symptom for which no organic cause can be found, or an organic condition which appears to be causing a quite disproportionate degree of distress or disability. And these, preeminently, are the patients who tend to be surprised at having symptoms for an unconscious purpose. This is a long chapter. Sometimes this suspicion is justified, as in the case of the patient I described in the second chapter, who suffered from a paralysis of her legs. In that instance, the purpose was quickly discovered, and as soon as she could see a more acceptable way of dealing with her situation, the use of her legs returned. But there are occasions when the therapist, to his own entire satisfaction, has exposed the patient's unconscious purpose, yet the symptoms still persist. At such times, it may be particularly tempting to assume that the patient prefers to continue to be ill. Undoubtedly, in certain instances, this assumption is well founded. But very often, I believe it is grossly unjust to the patient, because his symptoms, like those of some of the sufferers from hypochondriasis, are a resonance to an earlier supraphysical. So, and I continue later with the examples he gives for this. Today is the 30th of August, 2024. Have a lovely Friday!